to all of you. I'm Dr. Anju Ghai, Vice President and Head Preventive Healthcare at VLCC, with over 35 years in medical and wellness practice. And with me today are very esteemed co-panelists, Padma Shree Dr. Anoop Misra, India's leading authority on diabetes, Senior Cardiologist Dr. Dheeraj Bhatia, and Nutrition Expert Dr. Deepti, each of whom you will meet shortly. And you all know VLCC as a leader in beauty and wellness domain is present in 310 locations across 12 countries in South Asia, Southeast Asia, GCC region, and East Africa. And our wellness program is recommended by IMA, the Indian Medical Association. Today's webinar, as usual, is part of a monthly series of webinars, our educational contribution to holistic wellness through quality information and healthy lifestyle choices. And you know what? November is such a very, very special month for us. Every year we observe the 26th as the Anti-Obesity Day. And this is the time, this is the month when we renew our commitment to wellness for all and a special focus on preventing and eliminating obesity and also so many complications and consequences. And so today our focus is diabetes. So what's this diabetes all about? So diabetes is a group of diseases, the one in which body doesn't produce enough or any of the hormone called insulin. Now, if there's no insulin, that's the type 1 diabetes, an autoimmune condition found usually in young people. And type 2 diabetes is where the body doesn't properly use the insulin that is produced, or it may be a combination of both. And the third is the gestational diabetes, which occurs only during pregnancy. In any of these conditions, the cells in the body are unable to take the glucose from the blood into it, and this results in fatigue and constantly run down feeling. So while there is so much of blood in the sugar, while there is so much of sugar in the blood, I'm sorry, and very little is there in the cell. So diabetes can unfortunately go undetected for years. So it's innocent looking symptoms like frequent urination, unusual thirst, extreme fatigue, extreme hunger, frequent infections, tingling or numbness in hands or feet. You know, they often go unreported until it's too late. And that's why diabetes is a silent killer. And we are sadly, diabetes capital of the world, India. Yes, the most recent data from Ministry of Health and Family Welfare shows 11.5% of Indians above the age of 45 having diabetes, and with over 26% of those aged 60 and above living in urban India. In fact, the number is growing at an alarming rate, and the worst thing is even the younger lot is getting affected. So we want to make sure that you will not become one of them. And so that's why, if not diagnosed early and managed appropriately, the consequences can be very serious, even life-threatening. So over the last year and a half, we also saw people with diabetes experience far more severe, COVID infections and complications, and unfortunately, very high mortality too. So the good news is the risks can be avoided. Timely detection and management of diabetes is thus the most sensible advice. Catch it early, known as the pre-diabetic stage, and you can stop it. So, why not prevent it to start with? And what should be done to stop its progress? This is exactly the scope of today's webinar, understanding how to prevent and learning how best to manage diabetes if you haven't. And we all know yesterday was World Diabetes Day, but we should not need an annual reminder to stay healthy, right? It should be part of how we live our lives, make right choices, and about what we do, what we eat, how we live, how we exercise. So let's learn how. Let's see. So our esteemed panel of highly experienced doctors will address the most frequent questions you have asked us while registering and any others you may ask us as we go along. So I'm very, very delighted now to welcome and introduce to our first panelist for today, Dr. Dheeraj Bhatia. Dr. Bhatia has over 35 years of clinical consultancy practice in New Delhi and has been a senior consultant cardiologist with Escorts Heart Institute and Max Super Specialty Delhi. He has been the senior medical advisor to VLCC for last 20 years. Good afternoon, Dr. Bhatia, and welcome to the webinar. Thank you so much for joining us.
Good evening, Dr. Anju, and very good evening to all the viewers who've taken out time to attend this webinar. And, basically, I think let me put things into perspective. But before that, let me introduce a very dear friend who's sitting here, Dr. Professor Anoop Misra. We go back, I think, a long time, as long as I've been practicing, a very long association. Important is that he's the tallest man today in the country when it comes to diabetes. I think, normally you say he's in the top 3. I always say he's just number 1. Simply that, just that. And, besides the Padma Shree, the BC Roy Award, and I think what really takes the cake is over 340 publications. So I think we're very lucky to have him here. His publications have been in the most prestigious journals, and he's a great combo of being a good clinician and a scientist, which is very rare. You see, I've spent my whole life doing clinical medicine, but he's like a combination of both. So a lot of appreciation goes there. Okay, so having said this, Anju,
yes, thank you so much, Dr. Bhatia. And of course, yes, like we said, we are so very honored to have Dr. Misra today with us. So let me start with a question for you, Dr. Bhatia, which has been coming up. And so why is there so much concern these days about pre-diabetes?
Right. So basically, once diabetes comes on, there are a lot of complications. There are many complications, but the ones which are very common are like, the heart, so leading to a heart attack, stroke, eyesight problem, leading to microangiopathies and then problems. Get it the whole night screaming with leg pain, and then finally leading to paresis, which means not really paralysis, but weakness of the legs, and then bladder problems and kidney problems. So you've heard of people on dialysis. So it affects nearly all the systems in the body. So the focus is going to be of this webinar is how to identify this problem, which is pre-diabetes, because pre-diabetes is actually same thing as insulin resistant, which finally leads to high insulin in the body. Now, if you have high insulin in the body, that does not mean you have blood sugar, which is high at the moment. It's high insulin. Now, insulin is very difficult to pick up. It has a very short half-life. So since you can't pick it up by blood test, you can, but then things have gone beyond. So we rely a lot clinically. So it's very important today to very simply share certain points, which are pointers to everybody in the family. Charity begins at home. So you see these things happening to your loved ones, your father, your mother, then you start thinking, hey, this is the time I need to meet a consultant, medical consultant who can guide me further. So basically, having said that, a very, very short, what is the physiology? So when I take carbs, actually, as they go down, basically what we need is it in the tissues. Now, for some reason, it does not go into the tissues because there's something called insulin resistance because of many factors. So it's there in the blood, and there is no energy which is going into into the tissues. So the first symptom which comes is fatigue. Very important. When somebody keeps telling you, your mom or your dad or somebody, that we are fatigued all the time, especially if they're overweight, and you find that they've got central obesity, that's you should pick up your ears. And especially when you've ruled out other simple causes of tiredness and fatigue. For example, low hemoglobin, anemia, or you've ruled out low B12 or low vitamin hydroxy D3 or hypothyroid. So when you ruled out these and you find that a person is still fatigued and saying that, I have no strength, no energy, and there's no reason, you should definitely think a person has got high insulin, which is pre-diabetic condition. That's one. Now, the response to the sugar or glucose not going into the tissues are screaming with, there's no energy and sometimes in pain. So they are sending a message to the pancreas, which is the mother, which actually makes insulin. They say, help me, mother, help me, in simple terms. So the pancreas releases more and more and more of insulin, right? Now, insulin is a lipogenic hormone. So insulin's job is actually to open the receptors, but it doesn't happen that way. It's blocked. So they release more and more and more. And insulin, too much of anything is bad. So what insulin does is it converts more of glycogen into fat. So therefore, you'll end up with a fatty liver. It also slows down, it increases lipogenesis. Lipogenesis means increases the fat production because it doesn't allow fat to be burnt. That's another thing which insulin does. It also sends the fatty acid triglycerides to the adipocytes. Adipocytes are the storage cells in the abdomen, right? They're the ones which store. So you start getting a belly. So if your belly goes more than 80 centimeters in females, more than 90 centimeters in males, it's a red flag. It's a red flag. So more than 80 centimeters in females, more than 90 centimeters in males, that's called central obesity. It's a very high pointer, especially if you've got family history of diabetes. So to reiterate, fatigue, central obesity, I've given you the values of family history of diabetes. These are pointers. Now, obviously, if there's going to be so much, fatty acids moving around the body, they finally go to the liver, and then you have a fatty liver. Now, when the liver is fatty, it can't produce much of good cholesterol, which is HDL. So your HDL falls. Now, also free fatty acids move along with triglycerides. And triglycerides, actually, a lot of them come from carbs. And what insulin is doing is converting this glucose into glycogen into triglycerides. So more triglycerides, there's a pouring out of triglycerides, and that goes and gets accumulated again in the central nervous system. That's a problem. So there are other pointers. We take a history of gestational diabetes. When a lady says, oh, Dr. Saab, I had diabetes during pregnancy, but now I'm fine, but I'm just not losing weight. So that's another pointer. Anybody who gives a history of high birth weight babies, more than 4 kilos, that's another pointer. Now I'm coming to a very important point. You will have people coming, we have so many patients and clients, they come and say, we gain weight very easily. Classical example, twins. They look absolutely alike. Same eyebrows, same hair, everything. The twins, the girls, the one who's 140 kilos, she points to her sister who's 50 kilos, and she says, look at her, she's eating the whole day, and she's thin as a stick. So in the old days, we used to say, no, you're depressed, you're binging. But now we know that the one who is, not being able to lose weight easily, she has got high insulin, because insulin is lipogenic. And I explained why. So similarly, you gain weight easily, and you can't lose weight easily. You cannot lose weight easily. It's a real, you'll have the best dietitians, the best fitness people, and the person is not losing. So unless you address this condition, there'll be a problem. There are certain stressful situations also which create a problem. What is that? One of the main stressful situations is your sleep. That's why I tell chronic sleep deprivation, not 1 or 2 nights. Chronic sleep deprivation, especially if you're a patient of OSA, obstructive sleep apnea, where your oxygen is falling down all the time, right? Then the stress hormones get released. Besides catecholamines, you also get, and cortisol, body also makes steroids, you also get a release of insulin. So high insulin levels, then the whole thing starts again. You start gaining weight, there's obesity, there's weight gain, and finally obesity, then the complications, all these things start happening. So it's a real cause for worry. One last point, very important pointer. A lot of people ask me that what is the relationship? We have blood pressure and pre-diabetes. What is the relationship? So basically, as your insulin goes high, insulin does not allow sodium to be excreted out from the kidneys. Insulin does not allow sodium to be excreted out from the kidneys in the urine. So you're having retention. So when you have retention, you will have what? You will have edema. First thing is edema, swelling in the ankles. So you press your thumb for 20 seconds and you see pitting there. That can be done at home as well. And the next thing is that if the sodium, as you know, what happens is your just stimulates the sympathetic system. So in our body, there's the sympathetic and neurology. Nervous system is divided into sympathetic and parasympathetic. Sympathetic is one of excitement, fear, flee. Parasympathetic is a calming one. So to calm it down, that's why you find the yogis doing well. They're thin, because if you do pranayam and you take it easy, you're calm, definitely your insulin will. But if you're hyper all the time, type A personality, and your insulin is going to start rising. And when it starts rising, again, that whole cycle of weight gain starts, central obesity, and then all the complications which we were talking about. So these are, and another condition for females who are sitting here, which it goes hand in hand, is PCOS. PCOS goes hand in hand with insulin resistance, polycystic ovarian syndrome. So if you do not correct, you may be able to correct your menstrual cycle, right, with medicines. But if you do not correct your insulin resistance and hyperinsulinemia, high insulin, you will not correct your PCOS. So you need to take medical advice for this. There are some very simple signs. One is, you can start getting more skin tags. Many more. One or two is common. You find many skin tags coming up. Second is blackish, velvety, rough areas of skin in the folds, especially in the neck. In the neck, if you get it, it's called acanthosis nigricans. You could also get it in the groin. Also, you can get it in the axilla, right? So then if you're PCOS, you can get acne, excessive hair. And so these are some of the signs which we look at. Edema is another sign, which I just said. Your central obesity is another sign. A fast pulse rate is another sign. These are the signs which we pick up. So it's very difficult to pick up by lab tests. But anyway.
Yeah, thank you so much, Dr. Bhatia. That was so wonderful. Just to summarize for everybody, Dr. Bhatia has highlighted that pre-diabetes is reversible, while diabetes can only be managed and controlled. It is lifelong effort, and if neglected, the consequences are usually very severe. So don't ignore any of the typical signs of pre-diabetes. Like he said, if you're gaining weight and not able to lose it in spite of trying hard, there is central obesity, you get fatigued more easily, develop high blood pressure, faster pulse, develop edema, or you notice darkening of skin in the neck or armpits or groin, or experience menstrual irregularities and acne in ladies, or you notice skin tags. And of course, he also talked about obstructive sleep apnea with snoring. If it is there, then suspect pre-diabetes, especially if there is a family history of diabetes or if you've had gestational diabetes. Just get yourself checked. Thank you so much, Dr. Bhatia. But, we have other question that once we suspect pre-diabetes, how do we find out that we are pre-diabetic? Are there any common blood tests to diagnose the pre-diabetic condition, Dr. Bhatia?
Yes. So besides this clinical profile, which are just made for you, you also have certain blood tests. But mind you, the blood tests are not always, they're not always affirmative. That's a major issue. So that's why I go a lot by clinical. But yes, there are blood tests. So let's start with something simple. You do a fasting blood sugar. You do a fasting blood sugar, less than 100 is normal. We all know that. And more than 126 and on is diabetes, fasting. So 100 to 125 of your fasting blood sugar is a thing what we call IGT, impaired glucose tolerance, which means that you are in the range of high insulin or insulin resistance. So that is one. Similarly, you could go to the PP, postprandial, which is usually 140 to 200 is the range where you say, okay, you're pre-diabetic. 140 to 200, you say, all right. More than 200, then you're diabetic. But the most important test is your HbA1c. HbA1c is your 3 months average blood sugar, which takes into account your spikes and your plateaus. So it's very important because it gives you an average of even your spikes and your plateaus, because you may not be spiking all the time. So less than 5.7 is normal. 5.7 to 6.2 is your pre-diabetic range, which is your high insulin range. More than 6.2 is diabetes. The West takes 6.4, but in India, we've changed it to 6.2, and that tells us. Then, of course, we look at other tests like low HDL, because your HDL, your liver is fatty liver. It's not going to make the good cholesterol, and the high triglycerides. Then when the triglycerides are high, then, a lot of people, doctors say, oh, it's part of the lipid profile, cut down your fats, cut down. It's actually coming from carbs and because of insulin. So you need to work very hard on your triglycerides. So high triglycerides, low HDL, I've told you about the HbA1c values, the fasting blood sugar, and of course, if you've got PCOS, then we do FSH, follicular stimulating hormone, and LH. The ratio is reversed. And there are many other tests for PCOS. We'll not go into them now. Ultrasound, fatty liver, very good pointer, especially if you're non-alcoholic, not taking much alcohol, and you're getting a fatty liver and it's progressive, then one should definitely keep in mind that a person has got hyperinsulinemia. Also, sleep apnea. You do a sleep study. Again, you find a person's oxygen is dropping rapidly. It could mean a pointer, is there. And then don't forget your simple measuring tape. Always look at your central obesity, 80, 90, again and again, I'm, bringing that up. And of course, the BMI is very important. That, I think, Dr. Anoop Misra was instrumental in changing the BMI from 25 to 23. So beyond 23 is basically overweight. And in the old days, it used to be 25. And now it's 23. And of course, I'm sure he'll explain that later on. But I think today he's going to spend more time on management. So look at that. So, Dr. Anju, I think enough time. I think we should
Thank you
introduce
so
Dr.
much,
Anoop Misra
Dr. Bhatia. That was really very, very insightful about pre-diabetes. What are the things that we need to look into? How do we detect it? Simple blood tests. And of course, do look into your waist. Not more than 80 centimeters in ladies and not more than 90 centimeters in men folk. All right. So yes, let's go forward from here. So now if we have developed diabetes, so what is the best and the safest treatment? That's the next question. So I have received so many requests from so many of you about this, and to address this and related questions, we are honored to welcome Professor Dr. Anoop Misra as our esteemed guest today. Professor Dr. Anoop Misra was recognized with Padma Shree Award in 2007 and received the Dr. B.C. Roy Award in 2006. He's, as Dr. Bhatia has already said, he's among India's leading scientific authorities on diabetes. He's Executive Chairman of Fortis CDOC Center of Excellence for Diabetes, Metabolic Diseases and Endocrinology. Chairman of National Diabetes, Obesity and Cholesterol Foundation, and President of Diabetes Foundation India. And you heard, with over 300 research papers published, he's Editor-in-Chief, Diabetes and Metabolic Syndrome, Clinical Research and Reviews and Clinical Keys, Associate Editor, European Journal of Clinical Nutrition, Associate Editor, Journal of Diabetes, and my goodness, so much is there, Doctor. So this is not all. He has published a book in English and Hindi, Diabetes with Delight, a Joyful Guide to Management of Diabetes in India. Wow. So nice to have you, Dr. Misra, and welcome to our webinar. It's such a great pleasure having you today with us. Welcome to the webinar.
Thank you.
Misra.
Thank you. Thank you, Anju. Thank you.
Yeah. So there's so many questions coming up, but of course, the first one is, Dr. Misra, that what medication would you recommend for managing mild diabetes, which is not controlled by changes in lifestyle like diet and exercise, and especially in those who are also very overweight and obese?
Thank you. So, first of all, let me tell all the audience that diabetes is highly heterogeneous disease. So, in one person, diabetes is different, the other person's diabetes is different. And so one size doesn't always fit everybody. So everybody's treatment has to be individualized. Now, what Anju has asked is that what is the treatment for mild diabetes? Now, mild diabetes, let's define it like this. Say fasting of, as Dheeraj in very nice manner, he has told, up to 126, 125, we take normal, above 126, we take diabetes. So somebody has a 130, 135 fasting blood sugar, and a post sugar, which is up to 200, is considered to be impaired glucose tolerance. So say 210. So that's very mild. That's very mild. But then this connotation of this very mild is different in a younger person versus the old person. Because if it's there in 75-year-old person with established heart disease, then we use different drugs. If 75-year-old person with no heart disease, we don't use any drugs. If it's 30-year-old person with this kind of sugar, and despite his best as far as diet and exercise is concerned, then we initiate drug, because in young person, we don't want that person to have load of diabetes right up front. तो जैसे कहते हैं ना कि जब आप लड़ाई लड़ो तो आप एक दो आदमियों से ना लड़ो, अपने पूरे सारे टैंक्स वो करके फर्स्ट आप स्ट्राइक करो, फर्स्ट स्ट्राइक एडवांटेज लो. That is the way we do it in young people. And in such cases, age-old drug called metformin. metformin में हमारा सबसे ज्यादा एक्सपीरियंस है, हमारा मतलब इंडिया का. जब मैं यूनाइटेड स्टेट गया तो वो लोग पूछते थे कि साहब मेटफॉर्मिन कैसी दवा है, क्योंकि वहां पर वो जानते नहीं थे, उनको उनके यूएस एफडीए ने अप्रूव ही नहीं करी थी उस समय. Metformin is a wonderful drug and very simple drug. Doesn't have too much of a problem. थोड़ा सा gastric upset कभी कभी होता है. तो in such cases we use metformin. Now metformin acts by improving metabolism. And in young people with even a slight diabetes, as Dheeraj is very nicely said, has multiple metabolic problems. So diabetes is one thing that you are seeing. There are 10 more things in that person. Metformin does a little repair here and there and everywhere. So this is the best drug, and a 15-year-old study has shown that metformin over a period of time also reduces weight a little bit. It's not a weight loss drug, but if you are doing excellent exercise and diet, it will help you in reducing weight. So maybe one tablet of metformin, maybe 2 tablets of metformin, and so on. It depends on your physician. And so we in young people start like that. In older people without a problem, we don't start. We say your sugar is increasing to compensate for decrease in the blood flow in the various organs. There is decrease in the blood flow with age. So through blood, the sugar is reaching less in every organ. And if we decrease it further, it will reach even lesser. We don't want that. In elderly people, we want good blood flow, we want good blood sugar in every organ, including heart and brain. So don't undue start any medication in elderly, while in young, do everything possible and hit it hard at this point. So that is one drug, and that's a remains cornerstone of treatment despite so many advances.
Wonderful.
So yes, we are using metformin in diabetes. We are using metformin also, as Dheeraj has said, in polycystic ovary disease. There is no diabetes, it's beginning of diabetes or just a pre-diabetic condition where metabolic regulation is required. So Aju, this is the drug, this is the commonest drug, this is the best-selling drug, this is the blockbuster drug.
Thank you, Dr. Mishra. So, like you said, nothing can replace a healthy lifestyle. And metformin is the gold standard medicine of choice, especially in young people, help them also in weight loss, provided they take care of their diet and exercise, and elderly, the mild diabetes can go without it. It's wonderful. So, Dr. Mishra, we also hear about gliptins as the new medicine of diabetes. And what are they and how do they work? And the viewers are also asking that can they arrest diabetes or reverse mild diabetes?
Okay, so as I understand, you have two questions. One is about gliptin, and the second thing is whether you can arrest reverse diabetes, right?
Right. Thank you.
Okay. Gliptins are general, is general class of compound. There are many drugs under gliptin. One of the first drug worldwide and in India was sitagliptin. Sitagliptin, it is known by a particular name by a drug company. And the other one is vildagliptin, and then other gliptins like linagliptin, teneligliptin, and so on. Now, gliptins are intelligent drugs. Why intelligent? If you're fighting a fighter like Bruce Lee, you can't just have one principle. Well, I will hit him and I will stand. When I will hit him and I will stand. Oh, that guy will totally devastate you in 5 seconds. Because if you hit him, he will go here. And you hit him, he will go there. You can't touch him. This is what diabetes is. You cannot have lowering of blood sugar always, like hitting him, lowering of blood sugar always. Once the blood sugar is lowered enough, you stop that. So once if you don't hit and you wait, that blood sugar should come up, because we don't want undue lowering of blood sugar. That's what this drug does. It lowers blood sugar, but once it is going danger point, it stops its action. How does it do that? It acts through another hormone called GLP-1, which is secreted from intestine. That's intelligent hormone. And it has got an on-off switch. And so the gliptins actually prolong the life of this hormone. That hormone, if released, gets destroyed in 2-minute time. This drug increases its level, maintains in circulation, and lets it do its work, which is on pancreas to improve insulin. So they are good. They are good drugs as far as blood sugar lowering is concerned, but do not cause or very little low sugar. We are afraid of low sugar. You should be afraid of low sugar because it can cause problems in 1 second while high sugar may not. So it does not. And that's why this kind of drug, Anju, is preferable in elderly. It is required. Then elderly people should use gliptins. Now, they're remarkably free of side effects. Oh, this is wonderful. I mean, who has heard of a drug which is free of side effects? Aspirin has so many side effects.
Wonderful.
And there are some varieties of gliptins which can work even when the kidney disease is occurring, when heart disease is occurring. It is safe in those. We should look at safety of each drug when kidney is getting upset and then heart is getting upset. These are drugs are safe. We now have, these are no longer latest drugs. We have had experience of 12, 13 years. I remember 2007, I gave first lecture in India for gliptin. And 13 years on, we have remarkable faith from these drugs, and we continue to use drugs after metformin in most of the cases.
Wonderful. So like Dr. Misra has said, gliptins are intelligent, safe sugar lowering drug with an off and on switch, good for pancreatic health and ideal for elderly. So that's a great news for diabetics, of course, only if recommended by the doctor. Right. So let's go forward. Dr. Mishra, we have another question for you, and which is like, are there any new medications, especially for obese diabetics? Because in VLCC, we have so many obese people coming in, and that's the question.
Okay, I've forgotten your other question, and there is another question which has come in on the chat back, which I should have replied right at metformin stage. Say metformin, people say it causes kidney injury. It doesn't cause kidney injury at all. It is beneficial for kidney, but if your creatinine increases and eGFR, which is calculated way of looking at the kidney function, decreases below 30, then we remove metformin, because then it can cause lactic acidosis. Otherwise, it is not bad for kidney at all. So those who say that metformin induces kidney dysfunction, they're wrong. So that is one clarification. The second about your reversal of diabetes. Yes, absolutely. This is something which is latest, or which has actually, it is not latest. Again, like gliptin, it is not latest. 2013, Kim is the primary author of the paper. 12 patients of diabetes, 600 kilocalorie liquid diet consisting of, inclusive of sugar. Look at this, inclusive of sugar in this liquid diet for 8 weeks. This was the primary proof of concept study, which showed that the blood sugar crashed down like this. Within around 10 days, patient lost liver fat, which Dheeraj was saying, and pancreatic fat within 4 to 6 weeks. And by 8 weeks, most of them reversed their diabetes. Wonderful. Despite sugar in this thing, but it was a markedly hypocaloric diet, which not many people can sustain. So the question arose that this is a theoretical thing and so on, and you can't keep a person on this diet in Indian setting, but there's so many dinners, social functions and things like that. So then came another study, which was around 2 years back, which was done in UK in the community setting. अब आपने कर लिया हॉस खास में, वो सब कम्युनिटी ले लिया, फ्री विलिंग, कोई हॉस्पिटल में नहीं आया, वहीं पे जा गए लोग, और उन्होंने पहले 1000 किलो कैलोरी डाइट का दिया, एंड देन फेज 1 में उसको ईज ऑफ करके, जानते हुए कि एवरीबॉडी विल नॉट बी एबल टू फॉलो, 1200 किलो कैलोरी का कर दिया along with the exercise, and found that over 1 year around 60% people with the these are newly diagnosed diabetes within 5 years, and they were all overweight, lost weight around 15 kg. Wow. And those who lost weight 15 kg, 80% reversed their diabetes. Those who lost 10 kg, around 60%, and so on. So it's just function of weight loss by this hypocaloric diet. Beautiful design. And we wanted to replicate this in India. Unfortunately, we did not get funding. We are trying, but we should be able to do it in the near future. So that is as far as the reversal of diabetes concerned. Remember, old, long-standing diabetes cannot be reversed. Diabetes in lean people cannot be reversed. Diabetes who are on very high insulin therapy cannot be reversed. Type 1 diabetes, please leave out from this this equation. So there are only subset of people who are markedly overweight and have recent onset diabetes up to 5 years of duration, can be reversed by this or by bariatric surgery. And in between are the drugs that you are asking. The drugs that can decrease weight and may have potential for reversing diabetes as well. So which are these drugs? These drugs are acting on two principles. One principle of GLP-1, which I mentioned earlier, and other principle of discarding sugar from the body through kidney by blocking a hormone there which absorbs sugar. So kidney in normal state, sugar comes in, absorbs, and goes back to the circulation. This absorption, if it is blocked, a lot of sugar flows out through the urine, and you all know that usually 1 gram of sugar has 4 calories. So 100 gram of sugar will have 400 calories. And if we lose 100 gram of sugar through urine, then we are losing 400 kilocalorie per day just by this drug. These are called SGLT2 inhibitors. Now 400 calorie for 10 days, 4,000 calories, and in 20 days, 8,000 calories. And so to lose 1 kg of weight, 7,000 calories are required. In 20 days, you will lose 1 kg of weight. Using this drug alone, of course, it always doesn't go by numbers like this, but it has good weight loss potential. And we have used it over 1 year time, and we published the data. We found that 3 to 4 kg weight loss. And many people have 10 to 15 kg also, and some people have none. So there's variation, but these drugs are wonderful drugs because they not only lead to decrease in the weight, but also markedly benefit heart and markedly benefit kidney. So whatever is at risk in diabetes is actually targeted by these drugs. These are oral drug, 1 tablet a day. Excellent. The number two are insulin. Sorry, not insulin, injection like insulin, but not insulin. These are GLP-1, which I mentioned earlier. Hormone GLP-1, something like this is made synthetically. These have great power to decrease appetite and burn fat through hormonal GLP. High levels of GLP-1 actually causes weight loss. This is exactly what happens in bariatric surgery also. And there's a high level of GLP-1 higher than this injection. So this injection can be given every day, or it can be given once a week, has potential of a person losing about around 10 kg of weight in 6 to 9 months time. This is tremendous. And in addition, also benefit liver and heart. So look at these. These drugs have multiple action, unlike previous drug where action was only on sugar. And this injection these are the injection sold in injectable form in India at this point of time, but better drugs of similar category are now available in USA, and oral drug of similar category will also come in future. So we are looking at tremendous advancement in drug therapy of diabetes. The way in last 10 years we have seen, I have not seen in previous 30 years. So this is the exciting era for diabetes.
Dr. Misra, there is a question. Yeah, sorry. Dr. Misra, there is a question, and the person is asking that what if we take this drug without having diabetes to lose weight?
Well, there have been attempts for that, and one of the variety of drug called canagliflozin was tried in non-diabetic people to lose weight, and people did lose weight, and but somehow the US FDA did not give permission, and no further trials were conducted. But it has potential to cause weight loss in non-diabetic people also, but unfortunately, because it's legally not allowed, we cannot give it.
Right. Thank you, Dr. Misra. That was so wonderful. Yes, this has been coming again and again, that during the last 2 years, there's been a lot of research on COVID-19 leading to diabetes. And as you have covered in so many of your articles in numerous prestigious journals. So would you kindly please share some details with our attendees and any advice you would like to give us who have suffered from COVID and also developed diabetes when they had it, and what they should be doing now? Some information, some guidance from you, sir.
Okay, so there are different kinds of diabetes which we have seen and we have written about in COVID-19. One is common type, undiagnosed diabetes. The IDF Atlas, which was released 2 days back, shows that 53% of the Indian population has undiagnosed diabetes. So if we look at the COVID patients, say 100 COVID patients, 50 of them will be, if we take the prevalence of diabetes in these COVID patients, it will be something like 10 to 20% of the people will be having overt diabetes, and another 20% will have undiagnosed diabetes. So some will be uncovered at that time because they are tested well. The others may have new onset of diabetes, not known to have diabetes earlier, because of either COVID cytokine storm, the poisonous type of storm which COVID causes, or direct attack of COVID on the pancreatic beta cell, which Dheeraj has so beautifully explained. So these are two types of diabetes due to COVID, and third type of diabetes is due to steroid. Steroids given may also induce new onset diabetes. So I would say if you look at the data on the new onset of diabetes, then out of 100 of such patients, around 30 will go back to non-diabetic status. Their steroids are removed, their COVID becomes better, they start exercising, following diet, and they will be probably without drug. But 60 to 70% may continue to have diabetes in subsequently, which can be controlled well. Now, the other thing is that COVID produces what is called a long COVID, which is a wrong term, but a post-COVID syndrome. And there, the diabetics are more prone. And this is the research we did and which was widely disseminated in the media just 2 days back. So fatigue and sarcopenia, muscle loss, is marked in patients with diabetes after COVID-19. And hence, unlike advice you might have heard that, oh, just stay in bed for 3 months after COVID, do nothing and just rest because otherwise COVID may come back. Is wrong advice. You should mobilize yourself as early as possible, do exercise as early as possible, have correct nutrition, and try to control your diabetes very well. If you do that, you'll be early on the feet rather than late on the feet. You will continue to suffer. So this is my overall advice to people that who suffered from COVID-19, that you should have advice from a physiotherapy expert, a nutrition expert, and your diabetes expert. A multidisciplinary engagement is required to put you back earlier on the feet and a better overall.
Absolutely, absolutely, Dr. Misra, because like if the saying goes, if you don't use it, you lose it. So if you're not exercising your muscle, you start losing them, you start losing your bone. So the earlier you are active, the better it is. Thank you so much, Dr. Misra. That was so really wonderful, and thank you for your time and so generously sharing your invaluable insights and advice around diabetes. I'm so sure our attendees have benefited immensely from your interaction, and it was so really wonderful. Thank you once again.
Just one word. I would like to thank Dheeraj, who has a great faith in me, and I hope I have sort of fulfilled his expectations. He's a great physician, great guy, a great friend, and I thank him for inviting me in front of, I see 300 attendees. That's wonderful, excellent, and if, because I may go early off this platform, if there's any questions, you can share my email and I'll be happy to respond to the question. Thank you so much.
Thank you so much, Dr. Misra. So kind of you, and we were really honored to have you. Thank you so much.
Thank you so much. Thank you.
Thank you.
Okay, so as Dr. Misra has advised us, while medication is generally necessary, lifestyle changes are perhaps even more critical and necessary in managing diabetes. Managing our weight through diet and exercise is always necessary. So let's first understand how diet can help. To help us understand, I am pleased to now introduce our third panelist, Dr. Deepti Verma, who with over 25 years in the field of nutrition and dietetics, currently heads nutrition at VLCC Skill Development. So she has been an educationist, writer, and editor, and has been felicitated with several awards for her contribution to nutrition, including a Lifetime Achievement Award in September 2019, though she's very young. So welcome, Dr. Deepti. It's wonderful to have you with us today. And yeah, so I can
Thank you, Dr. Gai. It's a pleasure to be here with you every 15th and for this life transformation series to make diet and lifestyle changes. Yes, indeed,
Wonderful.
lifestyle and diet has a lot to do, as Dr. Bhatia has shared and Dr. Mishra has shared, that diet and nutrition has a huge role to play actually in the prevention as well as management of diabetes both. So to
Wonderful.
begin with, like I come across so many people who say that hum to sugar khate nahi hai, fir humko kyun blood sugar ho gaya hai. So for them, I just like to clarify one point that sugar in the body, sugar in the blood is not always the sugar that you put in the mouth. It is all the carbohydrates that you put in the mouth, because after the process of digestion, whether you've had cereal or we've had, the sugar from the milk, which is called lactose, or any other form of sugar, they all eventually, after the process of digestion, convert into glucose. And that glucose from the intestinal wall gets absorbed into the circulatory system and then creates a flux there. So it is a wrong notion when people say that hum to sugar khate nahi hai, fir bhi humko diabetes hai. So it's not that sugar. It is like even cereal and grains that we have, excess of dairy that we have, all that actually gives a high blood sugar. Now, when I talk about the diet management, so of course, for the prevention, of course, we have to take care of the following factors in the diet that I would be definitely, categorizing. But other than that, like for the complete control, if one has already been diagnosed with diabetes, so there are stricter little of dietary norms that I would be talking about. So first, of course, is control the carbohydrates. And that's very, very important. Carbohydrates generally are present in all the cereals and grains. It is also present in very high sweet fruits. It could be present in, of course, it is present in white sugar. It is present in jaggery. It is present in honey, brown sugar, because normally people say that, oh, we take brown sugar and we take honey and a jaggery, or we take a date sugar. So, like they're doing a good thing. But no, if you've already been diagnosed with diabetes, one needs to actually eliminate all these forms of sugars, whether it's a white sugar or a brown sugar. Brown sugar is basically just minerals added in the white sugar. It's also called a mineral sugar. And when we talk about the date sugar and honey, they are all form of simple carbohydrates. They all raise the blood sugar levels. And even the cereals, so to speak, they are all very high on carbohydrates. There are, of course, like ranges, how it elevates the blood sugar level. So bajra and jowar, of course, do not raise the blood sugar level as much as wheat does. So yeah, there are differences. Like rice, of course, is a high glycemic index food as well. So white rice raises the blood sugar level. So, it's very important to be having these cereals with high fiber. So of course the bran or the husk can be added to the chapatis and to these cereals while consuming. And it is important not just for prevention but also for the control of diabetes. So of course, like with this, taking a lot of fiber in the form of vegetables and salads in every meal becomes imperative, because when we have a high fiber in our plate, whether it is chilke wali dal, so the husk of the dal, of course, which is intact in the pulses and legumes, and also the vegetables and the salads. So these are high fiber foods. So they lower the absorption of glucose from the intestines into the circulatory system. So hence very important to have the fiber. Now people often ask me, that can we have, bananas and the sweeter fruits? So for them, if you've been diagnosed with diabetes, then it is very important to kind of control the portion sizes. So of course we can have bananas, but only half a banana. If you're having mangoes, it is better to actually, take partial mangoes, like half of the mango at one time, to reduce the glycemic load. And in case of uncontrolled diabetes, if it is extremely high, that is the fasting blood sugar, when it is above 250, then one needs to not have these very sugared fruits. And instead, we can go for the fruits which are slightly low on sugar. So these are, about the carbohydrates. And other than this, as Dr. Bhatia has mentioned, that the cardiovascular disorders and diabetes actually are like siblings. They go hand in hand. So very important for us to have healthy fats, especially the polyunsaturated fats, like the liquid fats that remain liquid at the room temperature. That's what we call as unsaturated fat. And if you've already been diagnosed with diabetes, it is always advised to actually totally eliminate the saturated fat, या जो जमने वाले तेल और घी होते हैं at the room temperature. or at the temperature below 20 degrees Celsius, उनको हम बिल्कुल भी recommend नहीं करते. So this is about the oils and fats, and of course the snacks that, because diabetics feel very hungry intermittently, on and off. So it's very important that we choose our snacks very wisely, and it is always important to go for something like nuts and something like bhuna chana, so these are the kind, instead of going in for makhanas and, lots of mangoes and things like that. So to choose the snacks very, very wisely. So these are little tips that I can give to the diabetics.
Wonderful, wonderful. Yeah. So Dr. Deepti, are there any very specific foods recommended for diabetics? Like, something very specific?
Oh, yes. I mean, we normally call them functional food in the nutrition science. So there are, 3 foods that immediately come to my mind, when one talks about controlling diabetes. So, but then these foods need to be taken only when one is diagnosed. Otherwise, they can go low on the blood sugar, which is even, like more serious. So the first food, that we recommend to a diabetic is the fenugreek seeds, that is methi dana, a very popular spice in India. So this can be added to the vegetables, but for a diabetic, it would be very, very, effective if they take it as fenugreek seeds, infuse water early in the morning without brushing the teeth. That's how we recommend. So one needs to take like 10 grams of fenugreek seeds, which is infused in 1 glass, like 250 ml of water in a kaach ka glass, that is in a glass. And then in the morning, one can strain and drink this water as the first meal of the day. And after brushing, one should also eat the soaked fenugreek seeds. So it's very important, because actually what happens is that the fenugreek seeds, they contain a very good fiber, which is known as glucomannan, that actually firstly also does not let a lot of glucose get absorbed into the systemic circulation. And other than this contains some other like trigonylene and phenogreccine chemicals, which actually has hypoglycemic effects. So that way it works both ways. And of course, the second food that comes to my mind is turmeric powder, or the turmeric, which looks like a rhizome ginger. And the raw turmeric is advised, other than, and not surely the powdered one, because that just could be a bit adulterated. So that, of course, can be taken in the form of, again, infused water. It can be taken as a turmeric tea, or it can be taken as a pickle, which we can just grate and add some lemon juice on the top, and can be taken with the major meals. So, turmeric contains a chemical called curcumin that works wonders, in its effect of lowering the blood sugar levels. But whenever we take turmeric, it is very important to take it with some peppercorns or crushed peppercorns, which contains pepine, which actually enhances the absorption of curcumin into the blood. So yes, this is, these are the foods. And third, of course, is a vegetable, which is called karela or bitter gourd, very popular in India again. And that, of course, contains very important beans, and it contains 3 very powerful chemicals which help lowering the blood sugar levels, which is charantin, vicine, and polypeptide P. Works wonders, but the way we make karela is very important. We normally burn it or extra brown it so that, the bitterness reduces. But no, when we are giving it for the hypoglycemic effect of it, we have to barely cook it and make it softer. So that is the way to actually have it. And karela also works wonders, and it can be taken in the form of vegetable 3 to 4 times in a week. So these are the 3 primary, functional foods I can think of that have blood glucose lowering effect.
Thank you. Thank you so much, Dr. Deepti, for wonderful, healthy insights. So, like Dr. Deepti said, what you eat is very, very important. Lots of fiber, fruits, vegetable, legumes, whole grains, and healthy fat. And of course, food like fenugreek, methi dana, turmeric, and our age-old karela, which goes always hand in hand with diabetics. They should form a part of your diet if you want to, take care of yourself. Thank you so much, Dr. Deepti, for joining us. So, yeah. So the next question is, how does exercise help? Well, exercise brings down insulin levels, exercise brings down glucose levels, and it also, help you with weight loss. So it's a double benefit, right? Exercise also decreases your blood pressure. It raises your good cholesterol. It decreases your bad triglycerides. And like Dr. Mishra said, it increases your muscle mass, energy levels. And of course, it also helps in managing stress. So in fact, exercise can be especially helpful in lowering insulin levels after meal. So whenever possible, take a short brisk walk after you've eaten your meal before getting back to your routine. And every little bit will help. So the question now is, which exercises help to manage diabetes? So, since reducing insulin levels in the blood is the critical in treatment of diabetes, which happens whenever you exercise, I would like to offer you some suggestions here. So first of all, it is for prevention, and this is for everyone. If you want to lose weight, yes, so if you want to lose weight, 1.5 hours of activity is required in the whole of the day. So out of this 1.5 hours of activity for the whole day, 1 hour has to be moderate intensity aerobic exercise. So this 1 hour can be split up. Actually, it should be split up, or if you want to, across 2 to 3 sessions. It includes, what is aerobic activity? It is brisk walking, jogging, cycling, swimming, treadmill, cross trainer, dancing, playing sports, anything which gets your heart beating faster. And of course, one has to be well hydrated. And along with this aerobic exercise, one needs to add at least 15 minutes of resistance training, also called the strength training, okay, to build up the muscle mass. So you may use exercise machines in the gym. You can use free weights, dumbbells, resistance bands, or if you're not a gym person, then you use your own body weight. You can do crunches, lunges, squats, planks, arms and leg strengthening exercises. In fact, yoga and tai chi, though very gentle, also fall in this group. And you just need to do 15 minutes of this every day. Or if you can't do that, you may do 30 minutes, maybe twice or maybe thrice a week. But the thing is, avoid being sedentary. Take breaks from sitting, move and walk around as much as possible, because being sedentary and sitting too much is linked to an increased risk of obesity, no doubt. Again, type 2 diabetes, heart disease, PCOS, and also various types of cancers. So never ever lose an opportunity to get up and walk whenever you can. Yes. And of course, buddies, they help us keep motivated. So invite family, invite your friends to join you. Use a variety of exercise to keep you interested. Make exercise a regular part of your healthy lifestyle, and try to exercise at the same time of the day, and so that it becomes a habit. It should not be taken as a punishment. You have to enjoy it. And also, now, if you are diabetic, so this is very important. If you are diabetic, then you need to take some precautions. Now, hypoglycemia or sudden lowering of blood sugar is very common after strenuous exercise or exercising on empty stomach. So you have to recognize the symptoms of low blood glucose. When suddenly the blood sugar goes down, you may have lightheadedness. There may be rapid heartbeat, or you may be sweating suddenly. So one has to avoid exercising empty stomach and eat a meal at least 1 or 3 hours before you start exercise. Best is you should monitor your blood glucose. So if your blood glucose level is less than 100 milligram, then pre-exercise snack is very important. And if your blood glucose level is more than 250 milligram, then you delay exercise. Yes, both are very important. And the best thing is exercise only when you're feeling well. It is advisable to postpone exercise for 2 days after the last signs and symptoms of cold or flu, including fever. When they are gone, just wait for at least 2 days before you start exercising. Generally, it is best to exercise with a friend who is aware of your diabetes, so that she or he can watch out for early warning signs of hypoglycemia and get you help if required. And during extended strenuous exercises, one has to keep something with you, some carbohydrate, something like juice or fruit candies or anything like that, to prevent hypoglycemia. You should always have it in your with you in your purse or whatever. Also, wear comfortable clothes and drink plenty of fluids. Very important. For diabetics, another thing is very, very important, which is wear shoes and socks at all the times when you're exercising to avoid trauma to the feet. Inspect your feet on regular basis for, say, blister, corns, bunions, or any other abnormalities, as these may become very troublesome to treat if left unattended. In diabetes, healing is so much delayed. And also, if you have diabetic retinopathy, avoid activities such as contact sports, heavy weight training, or inverted hanging to minimize the risk of eye injury or complications. And always, always consult your physician if you develop any symptoms during or maybe even after exercise. Yes, so much so about exercising. Yes, the thing is, one has to be active, one has to exercise and enjoy. So we would like to leave you with a very positive message. Diabetes, though made out to be very bad, is actually preventable and controllable. Seek expert help early to understand what's best for you and take it seriously. Like Dr. Misra said, your management will be different from every other person. So losing weight is always the first good step, and keeping it off is the next one. So right medical treatment will help you manage your symptoms, and together they will work. Now, one more thing before we end this. Stress worsens the problem. So don't let it creep into your life. As best as you can, fill your life with friendship, family, pets, laughter, and love. And real relationships are the best support for lifelong healthy life. And finally, keep smiling. Feel good about yourself. You're special, right? So at VLCC, our focus is on the combined benefit of managing diet, activity, and lifestyle to keep our clients healthy and well for life. So that's why our team of doctors, physiotherapists, nutritionists, and therapists and wellness counselors, they all work together on custom design regime for each and every client to help them achieve their wellness goals. And it's not just about weight loss or centimeter loss. It's our health. It's your health. Yes. So thank you all for attending our webinar and guiding our discussions with your wonderful questions. And thanks again also to our expert panelists, Dr. Anoop Misra, Dr. Bhatia, Dr. Deepti, for all the learnings today. And if you wish to know more, there is a VLCC center near you where our team of experts is just waiting to meet you. So wish you all a healthy life filled with happiness and fulfillment. Have a good evening and goodbye. Thank you all for joining. Bye-bye.